Hey everyone, welcome back to the Neurologic Wellness Podcast. I'm your host, Dr. To Subconcussive, and today I'm joined by my guest, Dr. Ashkan Jaluli. Thank you for joining me today.
Thank you so much, Joe. I really appreciate your invite here.
Yeah, and you are calling us all the way from Vancouver, British Columbia, correct?
Yes, the beautiful Vancouver, British Columbia.
Yes, that city looks beautiful. I haven't been yet, but I can't wait to go.
Yeah, it's one of the most beautiful places on earth, I think.
Mm-hmm.
Yes, absolutely.
So, Dr. Ash, you wanted to come on today to talk to us about concussions, especially subconcussive blows, correct?
Correct.
Okay, so just for the audience to get a little background on you and your professional story, can you tell us a little bit about how you got so interested in concussions and treating this injury?
For sure. I actually, in 1996, I was a pedestrian and I got hit by a car and I broke a few bones, including part of the spine. And I lost my soccer scholarship, which I was supposed to sign with 3 different universities in the States. And I was in Toronto at the time. Unfortunately, that event just put a damper on the whole thing and all my plans in life as I was a pre-med student. And so with that, the whole adventure started, given the fact that everybody was just honing in to treat my musculoskeletal aches and pains and broken bones. I had a seizure in the hospital where I was, suddenly the medical doctors just completely reversed course and thinking that this is not a brain injury because CT scans and MRIs are normal. What happened? Why did he have a seizure? And from there on, frankly, for good 2 years, I was spiraled down mentally, cognitively, and I was not myself for a good couple of years until I was referred to, again, neurologist, psychiatrist, acupuncture, physio every day. Unfortunately, they compartmentalized every issues that I had and they treated every little compartment based on their scope of practice or their specialties. And the only one that I was actually able to get some good level of comfort and getting back to some level of normalcy was an upper cervical chiropractor that I was referred to, which I had no idea what chiropractors actually do. This is 1998. And from there on, I became so interested in the field, pursued chiropractic in Los Angeles, Cleveland Chiropractic College in Los Angeles. And after that, in 2004, as I was looking for more resolution for my issues, again, cognitive issues, mostly the fainting episodes that I had, seizures that I had to deal with, I found Carrick Institute, and I noticed that there's a whole different branch of neurology out there that I can benefit from personally for me, not knowing that patients could actually receive the same benefit. And many types of patients, not just concussed patients. And so since 2004, I've been pretty much following the Carrick Institute and keep going with it. And right now, after many years of studying with Dr. Carrick, receiving my diploma in American Chiropractic Board of Neurology, and then fellowship in American Board of Brain Injury, I followed also suit with functional medicine just to see what other things can be done metabolically. So it's been a good 25 years of experience, personal and then also academic, that I was able to put together the 2 of them after graduation. And I've been now in this field for 19 years practicing chiropractic and 17 years functional neurology and functional medicine.
Strong personal experience plus years of clinical training and experience. I think that makes you the perfect person to talk to us today about this topic.
Thank you. I hope to be of great help to the doctors, to the students, and the patients.
Yes. So what you experienced was more of an acute injury, right? And that might be what most people think of when they think of concussion and head injury. But what we're talking about today is subconcussive blows, correct?
You got it. Absolutely. And this is one of the most important aspects of me returning back to the so-called normal within, the realms of normal that they could be out there. And as a soccer player that I've always been, I identify myself with just 22 players running in the field after a soccer ball and trying to score a goal. And I'm a striker, and I've always been really good in heading the ball. And after the concussion and eventually returning to play, I was always very cautious, not because of just the broken bones, but also the fact that most doctors always told me to put soccer away, start playing something else. My psychiatrist said, do curling. It's less risky for you. And so I couldn't accept that notion. And I thought the best thing is for me to get back into what I love the most, but be as cautious as I can. And I started looking at the research and trying to figure out exactly what is going on. What can I do to not get back to that type of cognitive decline that I had, the memory issues that I had, or struggling in school. And when I went back after the whole acute stage of issues finally resolved, the most important part of the return of some of these symptoms were always me after a soccer game, whether I hit the ball or I didn't hit the ball with the head. And I just wanted to figure out why every time I am out there running for 90 minutes and struggling and body checking, etc., what is bringing on my symptoms? Until I was able to conclude that my heart rate was going up a lot faster than usual, but I would just ignore it. And I thought, all right, you know what? I was out of shape at some point, but I'm getting back into shape and I can do this properly. However, it was also the body checking, which translates to some extent a little bit of an impact to your body. And of course, according to Berlin Consensus in 2006, when describing what a concussion is, by a direct blow to the head, face, or neck, or elsewhere in the body with an impulsive force transmitted to the head, that's what could set off my symptoms again. And so over the past few years, with taking some of the courses with Dr. Carrick and Carrick Institute and some of the great practitioners out there, I realized that you don't have to really hit your head to get the concussion, obviously. It is a translation of force to the body that may actually activate some of those neural pathways that they were inefficiently neuroplasticized, or they were maybe damaged to some extent. And from there on, I basically put myself as a tester. And every time I headed the ball in a game, I would come back, do the SCAT test and see how good do I do or impact test. And frankly, it was more sluggish than before. And I would think, well, then there is a reason. And I started digging into this, and I realized that there's a lot of great research out there stating that fact, that subconcussive head impacts have long-term detrimental effects, just like acute concussions do have, in terms of neurophysiological effects and also cognitive effects, neurocognitive effects. And there were tests done and research done by Adnan Hariri in 2017, if I'm not mistaken, indicating that long throws in soccer, they utilize specific helmets, and they were able to figure out exactly the angular acceleration of an impact to the head or to the body, how much it reduces the integrity of the white matter in the mesencephalon, in the brain stem itself. And it was very clear to see that certain symptoms could back, but the lack of visual clarity without a symptom was equivalent to some reduction in neurocognitive abilities. And to me, that was clear. Just to follow up on that, which was really interesting, I'm sure some of our chiropractor fellows here, if they're listening to this, they have experience, maybe yourself too, you have experience when you adjust someone's upper cervical, they would say, wow, I can see clearly a little bit better. I feel like the shield or fog or filter is gone up my eyes. That's exactly what I would experience personally after receiving a treatment after the soccer game. That fog would clear up so quickly, and I thought, does it have to do with the neck? Obviously, it does, and that's what we know now. The neck is a super integrator into the whole brain, and hopefully more research is going to come out about that.
Mm-hmm. Yeah, and I'm glad your experience was with soccer, because I don't think soccer often gets enough attention when it comes to concussion and subconcussive blows. Usually football, hockey kind of get the
very true
the limelight, but I mean, how many times are you heading the ball in practice and in the game, especially practice? Probably more
very
so.
True.
I remember there was a story of an old EPL player who, back when the ball was a little more massive, and he was just known for heading the balls, and he later developed CTE. So that's probably something that we're going to want to talk about today.
Absolutely. And, I'm in Canada. This is the mecca of hockey, obviously, as you know, and everything revolves around hockey. Everybody talks about hockey concussions, and I do see good number of professional hockey players here. But of course, soccer is one of the leading, especially female soccer in high school was one of the leading sports in concussions. In terms of subconcussive blows, and that's huge in North America. They're both, I think it's high school football and female soccer in high school are the most subconcussive errors that we see, actually, and concussions. Mm-hmm. And this goes back to I did 1-2 hours event for CA units at ICA Fitness Symposium. And it was really interesting when I was going through the data. And the more I started reading about it, the more I started researching it, the more I found out that soccer is so underreported. Few reasons, and also even in the hockey, not every player gets concussed. There are a few challenges associated with diagnosing concussion in professional players, for instance, or even soccer players. A lot of times, most times, athletes don't want to lose their spots. So they take some credits off the symptoms that they feel. It's like, yeah, you know what? I just feel a little woozy. That's all. But if you start digging a little bit more, if you start assessing their eye movements, their balance or vestibular system, their gait mechanism, which is super important, then you'll see how wonky they are. I mean, including myself. This past weekend, yesterday and the day before, I had a 5 games playoff. And this morning I woke up not so sharp, feeling that I wasn't really 100%. So what I did is my usual, get a really super chill cold bath and do some stretches and do a little bit of a cardio. And I get back to my normal, using a little bit of a muscle massage on the neck, absence my chiropractor. So I'm going to the office and hopefully get an adjustment after this. But a lot of the patients, a lot of the athletes, they don't want to tell that there's a concussion. Legalities, tread date lines, soccer players they want to keep going because there are a few more people on their positions. They don't want to lose their positions. And that's one of the biggest problems and challenges that we have in our practice. Like, okay, if there are symptoms, you let us know the symptoms, but I'm still going to assess you as if you had all the symptoms. And once I have all the data, if I do the best, if I do the VNG test, if I do right eye assessment of the eye movement, and so on and so forth. And then, of course, the SCAT5 or C3 Logics or Cambridge Brain Sciences, you'll notice that the data is not within the normal. You always see some latency decrease or some increase in amplitude, especially when I use what is called neurocatch. I'm not sure if you're familiar with it, NeuroCatch is a ERP, or evoked potential, just like an EEG test, was invented. It was basically came to fruition about a couple of years ago, and Health Canada approved it here in Vancouver. Dr. Ryan Darcy, who's the main pioneer behind it. When we utilize that on patients with or without concussions, with or without symptoms of concussion, we can check their basic attention and the cognitive attention, auditory attention, the P1, the N100, P300, and N400. And there are, for each of those three categories, there are about, we can calculate the latencies and the amplitudes. Patients with subconcussive head impact, they come in, if we do the test before the season starts and after the season starts, we always see a decline in their cognitive component. And this also pertained to myself after that concussion, where I knew that cognitively, when I was in school, I could not perform the way I wanted to. And that's huge. I mean, that reduces your scores, your school scores. If you're in college and you're on a scholarship, you have to maintain certain GPA to be able to keep your scholarship. And especially in soccer, hockey, football, what happens is these kids are getting all, microconcussed or subconcussive head impacts. They accumulate during the season, then they can't really maintain a good GPA. And then that's my biggest issue. That how can we create a protocol in order to assess everyone with certain baseline that is unique to these athletes, so we can involve them in neuro rehab or give them tasks that are cognitive tasks or balance tasks, and make sure that they get back to their normal, just because they're not really complaining of different symptoms.
Right. And while kind of an acute TBI might be more dramatic, it might be more of a red flag for an athlete or a parent or a coach, these subconcussive blows can be a little more subtle, right? You talked about just kind of these gradual brain foggy feelings and things of that nature that you would feel and that patients would feel. At what point do you think it's appropriate that these athletes should be seen? And what are some of the metabolic processes that are going on in these subconcussive blows?
For sure, it's a great question. Interesting enough is that few research papers that there were in 2017 and 2020 talking about the metabolic aspect, or not directly talking about the metabolic aspect of these patients. It was based on subconcussive head impacts that they tried to design another one for high school athletes and do a preseason, midseason, and postseason studies. One of them was using NeuroCatch, another one was utilizing just basically specific helmets, and figuring out how many of these athletes had concussion, acute concussions, how many of them did not have concussions, and then look at the integrity of the brainstem, specifically the midbrain, as I mentioned before, using DTI or fraction anisotropy. And they were able to actually find out that there was a compromise in the white matter integrity associated with both athletes who had concussion and those with subconcussive head impacts, which indicated clearly that there is a blood-brain compromise based on the fact that tau protein was also detected on those with subconcussive head impact. So with that said, all it means is that there is a metabolic issue going on with this subconcussive head impacts. Whatever is creating the inflammation pathway, whether it's the impact of the head or is the impact of the body, cumulatively speaking, there are some pathophysiological changes that are occurring in this patient where the brain has lost its capacity to perform the way it used to do before the season started. And so in my practice, they obviously, because of our restricted type of licensure and scope in British Columbia, what I have learned over the past 17 years in states where I was practicing in Santa Monica, California, and doing definitely functional medicine and functional neurology at the same time, we would be able to, for every patient that would have, young patients, generally speaking, high schoolers or university students from UCLA, we would do the full gamut of assessments just to make sure these kids have a baseline. Of course, it wasn't a 3 hours assessment. We would do about an hour and a half assessment. We would pick and choose what type of assessments we would want to do with these patients. And then also a blood assessment and blood workup. We would do the blood workup and then figuring out exactly their vitamin D levels or the protein levels, the fasting glucose, fasting insulin, and their testosterone if they were male, and then progesterone, estrogen if they were female, just to see where we are in a baseline component. And then from there on, we would make a decision. So we did have few medical doctors, physiatrists, and myself. We would decide what type of supplementation we want to have them on. And here, based on my experience over the past many years doing this in the field, right now, my patients in Vancouver, they would get the B complex, they would get the omega-3s, a good amount of EPA, DHA, as well as vitamin D3, 5,000 minimum, just to start. Because I don't have the carte blanche to have blood work here for patients or send patients for MRIs or PET scan. I'm very limited, so I have to extrapolate some level of functional medicine that is within my scope to allow my patients to have slightly more improved metabolism, or at least reach that demand that the brain requires. And in terms of the treatment, they always know that if there are any dysfunctions, let's say in their eye movements, whether it's with pursuits or saccades or fixation of the target, or the reaction time, whether it's when we do Trails A or Trails B, or any type of, or also with their modified MCTSIB, for instance, or gait analysis, I show it to them. This is the normal, this is where you are. No symptom to yes symptom, it doesn't really matter. We're dealing with functional issues. We're not dealing with pathological issues. So then the faster you nip this, the better it is for you. So you're not in that category of 83 to 86% of people who will have some sort of a cognitive decline or neurodegeneration when they get older, simply because of concussion or subconcussive head impacts if they were undetected. That's usually my approach to the patients.
Mm-hmm. And because this can be such a life-changing process, right? Mm-hmm. Sometimes I tell patients, you've got sport for maybe 4 years, but you need your brain working for a lifetime.
Absolutely.
When things get pretty progressed. I guess at what age do you think it's appropriate for children, athletes, to make the decision to undergo sporting events that could, I guess, put them in a position where they're going to be undergoing these subconcussive blows?
It's a big question. Mm-hmm. It's a very important question. And I am going to be biased as a father of 3 kids. All 3 of them are involved in hockey, in soccer. One of them is soccer and basketball, and there's a lot of hits, obviously. And 2 of them also mountain bike, to my demise. So I got to tell you, it's a very difficult thing to address. And what I see mostly with younger kids, hockey players that I see mostly in Vancouver, 8 years, 9 years, 10 years of age, they come in, if they fall, they get, they hit the ground, they develop some concussive impacts or symptoms, I assess them. And I have to be frank with every parent out there, including myself. And I would have to say, look, this is a brain that your kid has to deal with for the entire life. You be the judge. I'm telling you, hockey right now with this type of impact is really not great. My soccer kids, you will not hit the ball in practice or in a game unless you must. So hopefully, and the fact that younger kids, they are not really into crossing the ball and hitting the ball, they're not really there yet, it's more of a footwork. I pretty much have forbidden for their team to hit the ball because I don't want to see them as patients, and to be honest with you, Dr. Joe, I can be the doctor to everyone except my kids. When it comes to them, I am completely blank. I have no idea what to do. And it's the weirdest thing. It's true. I think it's true for a lot of parents that they, how many times, your kid, something happens to your kids and oh my God, what am I going to do? You freeze, you just freeze. You don't know what to do. But to every parent out there, I said, look, I wouldn't start hitting the ball until 15, 16, maybe. Why? Because they're still going through a transition hormonally, growth-wise. Thus, all these things are playing a major role, especially teenage boys and girls. It's all a volcano of hormones. And if you disrupt those hormonal changes with subconcussive head impacts or acute concussions, you are creating a lot of changes down the line. And again, these are all anecdotal. It comes from 17 years, in clinic, never researched. There's no paper that I wrote about this, but the more you look at it, the more you understand that there are changes that do happen with these kids when they have multiple concussions. And at what point you're going to say, enough is enough? Nobody can help you in 10 years. I don't know. So to me, 15, 16 years of age is probably the cutoff.
And you probably see both worlds there, the want to play sport and the impact of playing the sport. And, I'm realistic. I know that soccer has been around for thousands of years in some form or another. Sport has been around for thousands of years. So people are going to find
for sure
a way to hurt themselves.
Absolutely.
So what strategies as clinicians can we implement to try to prevent the ramifications of those sports?
I think more of a community outreach program to different schools, to different youth clubs. It's really the beginning of that aspect. We just have to make sure that from a public health standpoint, put a little bit more of an emphasis on things that are going to cause issues down the line more than what is happening nowadays with our pandemic, if not more, at least at the same level of outreach, and just making sure that parents are aware of these things. Look, we can never, as you said, people always find a way to hurt themselves because sports have been around for such a long time. It's the way that people identify themselves with, myself, including myself, and I totally understand that. But at the end of the day, we need programs, we need education amongst parents who maybe they failed to be the pro athlete that they wanted to. Now they're just basically making their kids to become that, so they can, I guess, bring their dreams come true from their perspective, and then pushing their kids to become super athletes at the age of 11 or 12, so they can be bought out by European leagues or NHL or play some, what I'm saying, right? And so there's a lot of push in these programs, but I think coaching staff has to know this. Organizations that they create, that organize this whole thing, associations, sports associations, they have to understand that our kids are the most valuable things that we have for the future of the country, any country you live in, and you need to start taking care of them from a different perspective. Not everything is professional athleticism. Is not just all about money. It's their brain, and their brain is the one thing that they have for the rest of their life. And if you don't have a full functional brain, how are you going to live your life, and how they're going to live their life, and the economic burden to that same society that they're going to be part of. And that's so we do have an outreach program. I do have every parent that comes to the door, I always tell them exactly what it is. with some of the high schools, local high schools. Uh, Vancouver and chiropractic, they don't really match. Still is very, we are at the bottom of, I guess, the healthcare echelon. Not many people do listen to chiropractors here in Vancouver, in British Columbia. But from my perspective, because I'm one of the very few DAC and Bs and Fabirs in town, well, in the province, they do have a little bit of a respect as to when I say something, they do listen. And so hopefully, you know, from a community outreach program, educating them, we would be able to make some changes, hopefully.
Yeah, hopefully. It's hard to talk about this topic without exploring CTE. And I mean, that's been such a hot topic, especially in the past few years. I guess what do we see with CTE, and how long do we expect an athlete to be in a sport before, you know, that becomes a possibility?
You know, it's a great question, and based on the recent data from postmortem, it was a postmortem study that was done in 2019 or 2020. Athletes as young as 16 years of age, they manifested certain levels of CTE. It is where football players, high school football players. So when does it really start? You know, can we define concussion in sports just solely in sports, or a kid that falls off their crib, you know, when they were 7, 8 months old, did the CTE start there? How do we navigate that? How do we isolate those impacts? And I see so many patients, they would say, well, there was no concussion, but, you know, he's 8 years old. Yes, he fell on ice, hit his head. So from there on, he had some vomiting. He was dizzy. We couldn't ride in the car for a while. But I do remember he also had motion sickness every time we would drive long distance. And that came after he fell off his bike when he was 3 years old. Okay, so what can we establish a program in each hospital or GP offices to say, hey, you know, anyone who comes to your office with a possibility of a head impact, can we run a blood tau protein? I mean, it's expensive. They're not going to do it, especially in a socialized medicine like Canada, you know, that they barely do a glucose test because they want to make sure that you are somewhat close to diabetic or pre-diabetic before they actually send you for a blood work for glucose and H1C. So yeah, you can we do a peripheral tau, because usually it does parallel to central tau secretion in the brain when there is a neuroinflammation or a brain inflammation, which may instigate the whole CTE. But again, those are gray areas in the system that I think is not going to come out until we have a super MRI or some super neuroimaging that hopefully becomes more, I would say, economically feasible for people and for governments to pay for, to minimize the damages in the future. And so, yeah, CTE itself is a huge deal. Where do we go with that? 16 years of age, post-mortem, you have CTE. Or should we look at kids' behavior after their concussion, when their behavior starts changing, especially younger athletes who are volcanoes of hormones growing up, and then suddenly things change? Should we avoid suicides, murders, or depressions based on peripheral tau or central tau or neuroimaging? Maybe those are up for discussion. And I think it's going to be a very long discussion on that.
Yeah, not an easy discussion.
Not an easy discussion for sure.
Yeah, and we've had a couple of difficult topics that we've had to discuss on this episode so far. You know, this is heavy stuff that impacts a lot of people. So
sure.
It's very, very important that it's talked about, though. We are running up on the end of our time, Dr. Ash, but is there anything that we haven't touched on yet, or any additional words of wisdom for the audience?
Probably the most important thing that I would want to address in 30 seconds is for the doctors, the physicians who treat concussions, subconcussions, if they start looking into subconcussions. I think the most important thing that I would always say is that we have to listen to our patients. We really have to not just listen, but diagnose. 50% of our diagnosis comes from patient's history, and really listening to them. And I tell you from a patient's perspective, forget about my, later on becoming a physician, etc. Because I was a patient, and I do remember that I wasn't listened to the way I wanted to be listened to. And in many occasions, doctors do create their own diagnosis before even hearing everything that is going on with the patient, just because they feel more comfortable, or they just, they match two points to each other. It's like, okay, this is it. This is, therefore is this part, or this is that part. But I think for us, the physicians, we have to listen and listen and listen, and then perform an examination assessment that you would do for your own parents, for your own brothers and sisters. And I do really understand the financial aspect of it. I really think we are here, everybody needs to get paid for the time that they put in with the patients. But I think a slight amount of humanism in our medicine would do the trick, really, to take a lot of people back to some level of normalcy, with less financial burden for the doctor and the patient, and probably the whole community as the economy as a whole. But making sure that we educate our patients the way we need to. And that's my thing to the colleagues. And then to the patients, ask your doctors why or why not. What are the options besides what the doctor is telling you, besides what I'm telling you? Don't rely on one thing only. But I do understand we live in a world where, economically, we're not really all doing great. There's only a few people that they can definitely afford to do all these things. And the rest of us, try to find a solution for this, because there are functional neurologists, chiropractic neurologists everywhere. Or if they're not functional neurologists or chiropractic neurologists, they are very well-versed physicians that they have the best interest of patients in their mind. Seek them out and make sure they listen to you, so you can get the right assessment and treatment for improvement. That's really the most important thing.
Yeah, very well said.
Thank you.
Very well said. Dr. Ash, I want to thank you again for discussing this topic with us today. It was fantastic, difficult, but fantastic. So if anyone listening wanted to reach out to you, or find you on social media, anything like that, how would they go about doing that?
So website is probably the most accessible one. I am in Vancouver. There is, if you Google functional neurology, even though it's not an accepted, entity in Canada, in Vancouver, you'll still see me, because I clearly in my website I said functional neurologist in US, not accepted in Canada, so you can find me. Also, our website, equinoxdrs.com. Equinox, DRS is in doctors, drs.com. And then there's another website, which is our Canadian Brain Performance and Neuroplasticity Centers. If they just basically go to Canadian Brain Performance, we tend to pop up first, because there's only one Canadian Brain Performance system right now in British Columbia, and they can find me there. I run the program, Brain Performance, and I'm available to a lot of people via email. If they want to contact me, Instagram or Facebook, I think I have some presence there, although not so active. You can always find me with my name.
Excellent. Excellent. Well, we'll be sure to try to post that in the show notes, all the info. So
I appreciate it, Dr. Joe. Thank you so much for having me.
Of course.
Hope we see each other post-pandemic.
Yeah. fingers crossed it's not too
Yes,
much longer, but
I hope
I
so.
think I said that last year around this time. So
All right, all the best.
all right. Thanks again.
Take care. Bye-bye.
Yep.
Pleasure.
Bye. This has been your host from the Neuro Wellness Podcast. Be well.